everyone, welcome to Rainbow TV. Uterine fibroids. We often hear in females. So, what are the treatment methods and how to diagnose it? So, to get more information regarding it, we have a vascular specialist, Dr. Shaileshkumar. Let us talk to him. Hello, sir. Hi.
Hello, hi.
How are you?
Okay.
So, as we discuss uterine fibroids, we often hear that from females. So, what are the causes?
First, we need to understand this. The uterine fibroids are not cancerous.
Okay.
Because lot of ladies, they get scared that any swelling or any lump in the uterus, they consider or they think that it is a cancer. So
Okay.
first is that they should be relaxed that it is not a cancerous, and the possibility of getting it cancerous is less than 2%. So they need not to worry. But if they are suffering with the symptoms, then they need the treatment.
Okay.
Not all females with suffering with the fibroids, uterine fibroids, and if they don't have symptoms, then we can they don't require treatment as well.
Okay.
So that is the underlying thing. So the reasons for the fibroids to develop is the main reason is the hormonal imbalance.
Okay.
So these uterus fibroids, they grow or they form and they grow under the influence of estrogen and progesterone hormone, mainly the estrogen one. So ladies with a hormonal imbalance like polycystic ovarian disease, PCOD, we call it, often hear from a lot of ladies that I have PCOD or hormonal imbalance. Those ladies, they tend to have high chance of fibroid formation, and their fibroids are multiple and they can grow to a giant or huge size like 10 centimeters, 12 centimeters like. So first is the hormonal imbalance. Second is the overweight, obesity or fat. Because this estrogen hormone, they deposit or they stored into the fat. So ladies who are overweight or ladies who are obese, they are more tend to form the uterine fibroids. Other is fast food.
Okay.
A lot of fast food or oily stuff. So when these oils are nothing but fats. So similarly, when you eat more, the more formation of fat in your body and the more estrogen. So ultimately, it's the estrogen and supporting factors from the overweight, your diet, fast food, lack of exercise. Again, lack of exercise, you're not burning your fat, so more storage of fat. And some ladies with familial history, genetics, those whose parents or auntie or those grandmothers, if they are having in their family is running, then the possibility of more, they also have the chance they can develop the uterine fibroids. So these are the main reasons for the formation of the uterine fibroids. And if you have uterine fibroids, the symptoms is that not all the women they experience symptoms. So sometimes they are called silent fibroids. They don't cause any symptoms.
Okay.
And when they go for health checkup, these ladies, when they go for health checkup due to some other reason, scanning and all, they incidentally find these uterine fibroids and they get scared. So if you are incidentally detected without any symptoms, so need not to worry. You may not require any treatment for the uterine fibroids unless until you have the symptoms of for the fibroid related. So what are the symptoms related to uterine fibroid? So symptoms are typically divided into the two categories. One is the bleeding related problems like monthly cycle related problems, and the other is the pressure related problems. These fibroids, because of the size, sometimes they press in the adjacent organs and they cause pressure symptoms.
Okay.
So suppose if the fibroid is anteriorly, it can press the urinary bladder bag, so you can experience frequent urination every hour or 2 hours. Or sometimes you are not able to pass urine because it is pressing the urine tract and you are not able to pass urine only. If it is on the back side, then you can have the constipation or gas formation, or your tummy is always swollen up because of constipation and all. If it's pressing on the adjacent blood vessels, you can have DVT, or pressing on the nerves, you can have pain in the back, low back, buttocks area, or even in the legs, like radiating pain in the sciatica. So these are the pressure symptoms. And the bleeding related symptoms are patient can experience overbleeding or excess of bleeding, or they can have spotting, frequent spottings in between the periods also. And because of the overbleeding, they can land up into the low hemoglobin and anemia. So anemia related symptoms like fatigue, weakness, generalized weakness, all those symptoms will form. So these are the typical symptoms. If you are experiencing these symptoms, definitely then you require treatment, because sometimes if you are because I have seen patients with a hemoglobin of 4 also. They literally fainted, they are not able to concentrate, their generalized weakness is there, and they immediately have to, they brought to the emergency room, and when we checked their hemoglobin, it's 4, and they were bleeding continuously from down. So, see, it's not about raising her hemoglobin. We need to stop here the bleeding. Bleeding is the main reason for a low hemoglobin. So such patients we have treated on an emergency basis.
Okay.
Tell most of the patients, if you are suffering with the symptoms, then you require treatment, because there is a usual misconception that fibroids, if they are having no symptoms, or if they are having symptoms also, these fibroids can disappear after menopause.
Okay.
But if you are having fibroids at the age of 35, menopause is around 45 to 50. So you want the patients to suffer for 10 years. So I always tell the patients, don't suffer in silence. There is a treatment, because a lot of ladies are scared that most of the doctors, when they visited, they are given the option of remove the uterus, hysterectomy. Because now your family life is completed, you have kids, everything, why you want to retain the uterus? So a lot of ladies, sometimes they question the doctor, because I don't want to remove the uterus, like that, or some are scared for the surgery. But we have non-surgical treatment for it. Now you don't need to lose the uterus. It is not a surgery, it's completely non-surgical treatment through the simple hole in the leg. Similar how we take the blood saline or injections through our veins. Similarly, we can go through those veins and we reach till the fibroid, and we treat only the fibroids. It's a daycare procedure. It takes 30 minutes. You are discharged in within same day or next day morning, and you go back home. Take 1 or 2 days rest, home rest. That is not a bed rest. And from third day you are back to work. And fibroids are completely cured, and especially you are relieved from your symptoms like overbleeding, painful bleeding, and these pressure symptoms, they are relieved over a period of time slowly. So it's completely non-surgical. And what are the disadvantages? Like most of the patients, when they are suffering with these fibroids and they are almost desperate, like their life is sometimes miserable because of this overbleeding, painful bleeding, and they want the hysterectomy or uterus to be removed. And some ladies, those who have gone under hysterectomy just for the fibroids or these overbleeding symptoms, they experience miserable or horrible symptoms after surgery. So, because sometimes this surgical in the surgery, sometimes they don't not only remove the uterus, they have to remove the fallopian tubes and ovary, and they immediately land up into the postmenopausal symptoms. So they experience different kind of symptoms after the surgery, and sometimes they feel that the previous fibroid symptoms were much better than the surgical symptoms. So those are the two main things from hysterectomy. And even if the ovaries are not removed, still patient, if you are just removed the uterus, they still land up into the postmenopausal symptoms very early. Suppose a 35-year lady goes for hysterectomy, she will soon 1 or 2 years later, she will land up in postmenopausal symptoms. Postmenopausal symptoms, sometimes like bone pain.
Are very scary actually.
So those are the symptoms at a very early age, can be sometimes very risky. Even patients develop hypertension, cardiac stroke, heart stroke at very early age. And because bones become weak because of the postmenopausal status, they land up into early fractures. So this treatment, embolization, has completely ruled out this role of hysterectomy especially in fibroids. Because see, hysterectomy should be done if the patient is suffering from uterus cancers and all. There are indications for hysterectomy, but for a simple reason which is just a lump in the uterus, which is not a cancer, where the other much better non-surgical treatment, complete non-surgical treatment are available, then why should we go for the hysterectomy?
So in what stages we can avoid this hysterectomies? So
any ladies who are suffering with the fibroids, in all those ladies we can avoid the hysterectomy. In all those ladies, there is no indication for hysterectomy in the patients who are suffering with the fibroids. Especially those fibroids within the uterus. But definitely there is another surgical treatment option available like myomectomy. Myomectomy is just surgically removing the fibroid, that lump. So it is a type of surgery where the doctor goes into the abdomen, like same like how ladies can have the cesarean section. They cut open the abdominal wall, they cut open the uterus wall, they identify that lump and they remove it off. Then they stitch the uterus, then they stitch the anterior abdominal wall and they close it off. So that is also surgery. But when you have the non-surgical treatment like embolization, fibroid embolization, which is completely non-surgical, and it has success rate almost 90 to 95%. So the advantage is that you can treat 1 fibroids, you can treat 10 fibroids. You can treat smaller fibroid like 3 centimeter, you can treat a larger fibroid like 12 centimeter. So we have treated fibroids till 13 centimeter. We have treated fibroids, almost 12 fibroids in the same setting. So you need not to do any other treatment for if there are multiple fibroids and you don't have any scar on the uterus, you don't have any stitches on the uterus, there will not be any blood loss. And the complications of the major surgery like hysterectomy or myectomy, sometimes there can be injury to the urinary bladder. So in that case, the ladies can have lifelong problem with the urine. They can't hold their urine. They continuously pass and they have to wear the diaper for this. So those complications, all those related to surgery, we can completely avoid in this embolization.
So then how many sittings will be there? Ante should they stay at hospital? How many days should they stay at hospital?
It's a 30 minutes procedure. Just that's it. It's a 30-minute procedure. We keep them for observation for a day or so. Next day morning, definitely we'll discharge them, because it depends upon some patients, they are little more sensitive, so we keep them under observation for a day. And those who are not pain sensitive, we discharge on the same day by the evening. So 30-minute procedure, same day discharge or next day discharge, 1 or 2 days at home, so that their body heals fast and they can go back to work from 3rd to 4th day. Some ladies can experience, depending upon their number of fibroids, if there are more fibroids or the larger fibroids, they can experience little discomfort for a week or so, but that can be controlled with simple medications like paracetamol and dolo. You need not to have any strong painkillers also.
Like will reoccurrence observed?
The success rate is almost 90 to 95%. If I have seen 4 or 5 cases of not improving the symptomatically. The fibroid is shrink, but some patients, they are not relieved of their pain. So the success rate is almost 95%. That can happen even in myomectomy. If the myomectomy, the lump is not completely removed or some part is left behind, then that can regrow even in surgery. So the success rate is as good as the myomectomy in this embolization. The advantage is that you can treat multiple fibroids in the same setting. There is no blood loss, there is no cut, there are no stitches, there are no scars or cut on the uterus. So future pregnancy or future fertility is maintained. There are no imbalance with your hormones, so patient don't land up in the menopause after this surgery. And all the risks of surgery related complications can be avoided here.
Yeah, most of the people are not aware of this easy method,
definitely, right? Because there is not
they
much
are
of the
addicted to that hysterectomy.
There are 3 things about this why the awareness is not there. One thing is the patient are not aware about this treatment. Second is this treatment is not done by the gynecologist or the gynec doctors. Third thing, it is done by intervention radiologists, and the intervention radiologists who are trained or experienced for the uterine fibroid embolization, they are very few. These are the 3 reasons. That's the reason we are not seeing or hearing about the embolization treatment from the patient, or there is not much of the awareness about this treatment. But this is definitely, it's one of the gold standard. In the US, in the Western, this is the first line of treatment for the uterine fibroids. If you have fibroids, you are given the option of embolization first and then only. But here in India, we are given the option of hysterectomy first, second myomectomy, and you most of the times you don't even hear about embolization as well, which is completely reverse. And sometimes in few years back, we have read in newspaper like half of the village or village area, 50% of the ladies, they don't have uterus. Because their uterus has been removed for various reasons of the bleeding problem, and out of this various reasons, 70 to 80% cause was the fibroids. So fibroids has become a main reason for hysterectomy. But fibroids can be treated by non-surgical method because it's a non-cancerous thing. We can treat. There are options. There are indications for hysterectomy, but not the fibroid one.
If it is genetic cause, should it be treated?
See, it's genetic cause, but not every patient can have the fibroids. As I said, even if you have the fibroids, but if you are not having symptoms, you don't require any treatment.
Okay.
So the patients who are coming to us, they are actually suffering for hemoglobin. You can imagine what will be her condition, her general state. She will be very lethargic, weak, thin.
True.
They develop breathlessness if they walk, and they faint most because of the low hemoglobin. Their oxygen levels, their body levels will go down. They faint. So those are the patients who are suffering. So how can you let those ladies suffer for till they have the menopause? So that is not an option. You need treatment, proper treatment, and there are non-surgical treatments available for the fibroid.
Yeah, sir. Thank you. Thanks for the information and your
Thank
time.
you. Thank you.